1 second. Where you have shared this? Oh, okay. So this you are talking to Shahad. Name is Shahad, and
Okay.
she is 16 years old. She
Okay.
is a known case of cystic fibrosis and on regular follow-up.
Okay.
Okay. Her annual fasting glucose 8 millimole per liter, and 2-hour glucose tolerance test came 14 millimole. Now you want to counsel her about CF related diabetes mellitus, okay?
Hmm.
And she's asking about the mechanism and other things. So, okay.
Okay. I want to ask you something. This is
Uh,
like breaking bad news. We have to tell her that she has developed diabetes. Due
this is not only a breaking bad news. This is not breaking bad news.
This is
She knows
information.
that she want to know about how it happened, why I got this diabetes mellitus, and she's refusing for the treatment.
Okay.
So
This is
this is kind
teenager.
of ethical. Yeah, teenager kind of ethical.
Okay. Teenager refusing for treatment, and she needs explanation why she got diabetes mellitus, as I understand.
Yes.
It's like
Yeah.
information
This,
giving plus counseling her. It's not, she
yeah,
knows that she
information
has,
counseling
she
and
knows.
about ethical values here.
Okay.
Like she's 16 years old, so you will have to explore further her ideas, and you will have to counsel her. And if still she is refusing, how will you tackle all these things? So this is more like ethicals and information giving.
Okay, no problem. But she knows that she has got diabetes. She knows that.
Yes, she knows.
Okay, I will just take 2 minutes, and anyone can volunteer to keep time for us. Dr. Anamika, are you free? Hello.
I'll keep time. Okay.
Okay, Dr. Satish. When we start, I will tell. Now, I will just now, when I am ready, I will tell you, Dr. Rohel.
Okay.
I'm one of the doctors taking care of the clinic today, Shahad. I hope I'm talking. I have spelled your name right, Shahad, isn't it?
Yes, doctor.
Yeah, Shahad, thank you very much for coming today to the clinic. I believe you wanted to discuss today regarding your health. So is this the right time
Yes,
for
doctor.
you?
Yes, definitely. I came here to discuss, doctor.
Yeah.
I think you know that I have a condition called cystic fibrosis. So,
Yes.
doctor, now I got this diabetes. So I want to know about that. Why it happened?
Yeah. That's very nice of you to come today. I'm very happy to see you today. Shahad, do you have anybody to attend with you today, this discussion? Or it's okay?
No, doctor, I don't think so. Anybody needed. I am 16 years old now. I am no adult.
I'm very happy to hear about it. Well, Shahad, yeah, you're quite right. You have cystic fibrosis. And because of this cystic fibrosis, when the people who have cystic fibrosis, when they come into their teenage age, uh, they get this diabetes problem. Okay. Do you have any idea about this thing? Why does it happen?
No, doctor, I came here to, you know, I was diagnosed with cystic fibrosis. So
Yeah.
at that time told me about the cystic fibrosis, each and everything about that. And I was on regular follow-up. I had never missed my clinics. I never missed my antibiotic therapy, physiotherapy, each and everything I was taking. Now doctors are telling me that this is related with cystic fibrosis. I just want to know why it happened.
Yeah, this is, I know you're quite regular and you're one of the role model patients of ours, Shahad. Well, this is basically not because of you. This is basically a part of the disease process of the cystic fibrosis. Okay, you know, we have the basic problem with cystic fibrosis is the pancreas, isn't it? This is a small organ in our body which is responsible
Yeah.
for fat absorption. Okay, uh, all
Okay.
right, and also
Yeah.
this
Yeah.
is really responsible for the uh, controlling our blood sugars. Okay, am I clear until now?
Yes, doctor, you are very much clear, but
Yeah,
I'm not clear so much. Like
yeah, but
I have joined the group. Others peoples they don't have diabetes. Why I have? So this is my first.
yeah, this is a very good question, Shahad. Basically, it's not that everybody with cystic fibrosis will get diabetes, and also all the people in the same age
So
group.
doctor, what is the mechanism behind this?
Basically, the thing is that the pancreas, which is responsible for controlling your blood sugar, it gets exhausted. Okay, like you have this problem for quite long, and the pancreas is trying to work it out. Okay, but a time comes that it gets completely exhausted,
So
and
doctor,
that
what I have to do now?
yeah. It's all right, Shahad. We are all here with you. Just the thing is that, just like you were controlling your cystic fibrosis in a very nice and in a very compliant way, you will have to start taking insulin for it. Okay? You know what is
No,
insulin?
no, 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 doctor.
Yeah.
Hold it. I don't want to take insulin. I have seen my grandfather. He was taking insulin. It's very difficult, doctor. He was taking in his tummy, sometimes in his this arms. So it's very difficult. No, doctor, I don't want to take insulin.
I know it's very difficult, Shahad, and it's not easy for you. And sometimes with all of these medications and these regular follow-ups and all these things, it can be quite cumbersome. Okay, but I'm afraid it's going to be the only treatment for you, and believe me, this is going to be the best modality for you, Shahad.
No, no, doctor, I will not take. Do you have any alternative for that?
Yes, there are alternatives, but that is for people who are quite old. Okay, in teenagers with diabetes, the best solution is insulin. May I know what are your concerns, Shahad? I mean, why you don't want to take insulin? Maybe I can address them
Yeah,
out.
doctor, this is very difficult. Daily taking 4 injection or 5 injections, something like this. For
Uh,
this is I am too
yeah,
much afraid this needle
no,
phobia, and I will have to take in front of my friends sometimes. So it's very
no.
difficult, you know.
Yeah, these are very valid concerns, Shahad. But you know, let me tell you one thing. Like you know, with all the advancement in medicine and technology, like this insulin injections are also getting quite advanced. You don't have to take 4 or 5 injections. We will modulate the injections according to your requirements and according to your wishes.
No,
Okay, and
doctor, I don't want to take insulin. Please don't insist me. If you have any other alternative, okay, that's fine. If you don't have, okay, let it go like this. I'm
uh,
spending my life. I don't want to take.
you're a very compliant patient, Shahad. Like, I mean, you were a role model, and you know, it's just I know it's a very, I mean, there is a needle phobia, but believe me, if you see, I mean, we have a very nice team, and I will introduce you to a lot of children who are, I mean, students or like teenagers of your age who are regularly taking insulin, and they can even you can discuss with them as well. And we have a very nice cystic fibrosis diabetic team. The way cystic fibrosis team and the physiotherapy team is taking care of you, like I can book an appointment with you, and you can talk
Doctor,
to them.
doctor, I have lot of suffer from this cystic fibrosis. I have lot of admissions. I have taken these injections a lot of. Now you are telling me to take daily this injection. No way. I will not take. I don't want to take this insulin. Please don't convince me about this. If you have any other alternative, that's fine. Or if you don't know about the alternative, you can discuss with your senior. I
Sorry,
don't
two
want to
minutes
take
left.
this insulin.
I just muted. 2 minutes.
6 minutes,
Yeah.
3 minutes left, according to Dr. Satish. Okay.
2 minutes. Yeah,
Oh,
continue.
okay,
2 minutes left, sorry.
okay. You're quite right, Shahad. I mean, there are alternatives. You can take some tablets as well. Okay. There are tablets to control this blood sugar, and it can be controlled as well. But you know, this problem with the tablets is that, like, first of all, there are a lot of side effects related to these tablets, okay? And sometimes you have to take several tablets as well. And also you will have to strictly modify your lifestyle, and also you will have to modify your diet as well. The beauty of the insulin is that what we can do is, okay, I will not stress about the insulin right now, okay, just leave it for the time. What we can do is, I will refer you to the diabetic team. The first thing we can do is we can do some modifications of your diet, okay? But the problem with the diet is that the cystic fibrosis already causes a lot of weight loss and malnutrition, okay? So if we give you a diet which is going to control your diabetes, it will worsen your diet and your weight, okay? That might get affected, okay? The beauty of the insulin is that, like, you can eat as much as you want, and you can just use the insulin.
Doctor, I know these things all. I don't want to take insulin. I don't want to take insulin.
Okay, fine. The other way around is, like, I can refer you to with our some diabetic team involved with the cystic fibrosis. We can talk to you. Okay?
Okay.
Yeah. I'm extremely sorry I couldn't convince you. I think I will ask my consultant to talk to you as well. And let me summarize for you. Like, because of the cystic fibrosis, you are having diabetes, okay? This diabetes is because of the exhaustion of your pancreas, and because of it, the best modality would be insulin, okay? We have a very wonderful team which is responsible for taking care of cystic fibrosis related diabetes. We also have an endocrinologist, okay? You can talk to them and you can allay your concerns to them, okay? And maybe we can sort this issue out, okay?
Okay, thank you, doctor.
Okay, thank you very much.
Okay.
Okay.
Dr. Satish, time finished?
Time up, time up. This all is all good.
Okay, Dr. Faiza.
Wait, Dr. Rohel, just I want to give a trial only for this question, what you asked, before you give the feedback, like why this happened. This was the question, right? So instead of I will just try answer for this, then you give the feedback. She can tell that in our body, she was using pancreas, but I don't know whether she explained what is pancreas or not. I am not sure. So for pancreas, we can explain.
She did not explain.
Yeah, for pancreas, we can explain to her that there is a leaf-like gland in our body called pancreas. This gland is responsible for secreting a chemical substance which is called insulin, which is responsible for controlling the blood sugar in our body. But what happens here is, due to it's related to the cystic fibrosis disease process, that it affects this gland. Because of that, the reduced insulin is produced in your body. This is the reason the blood sugar is increased. If we say this much, is it enough?
Yeah. You will have to tell that, as this gland is related to cystic fibrosis, and I think she knows. You can ask. I think you know very well about the cystic fibrosis. So if you don't know, you can tell me. The thick sticky secretions that is characteristic of cystic fibrosis can cause damage to this gland. Okay. One more thing, this is actually the mechanism. This is actually the mechanism behind why they are
it was
getting
vice
this.
versa. I thought it was vice versa.
Yeah,
Because
this is
you will
why.
not control the
You can.
diabetes, the secretions will get
Yes.
thick.
Yeah. You said that exhausted pancreas has been exhausted due to cystic fibrosis, and the cell has been damaged. So you can say like that sticky secretions are there that is characteristic of cystic fibrosis. So this is the reason that can damage to the pancreas. So few things, just Dr. Faiza, I want to tell that in the beginning it was very nice. In the whole scenario, your tone was very good. You were I was shouting, and you were completely calm and cool. That's good. Uh, exactly, I don't know. This scenario came in last exam in Jeddah. So they want us to tell that as she was 16 years old, so she cannot refuse the treatment at this age. that is in the best interest of child's health. So in the end, you should tell that, okay, I'm sorry that I could not convince you, but we will have to arrange a meeting where your parents will be sitting with us also, because this insulin is best in the best interest of your health. So you cannot refuse the treatment at this moment. So we'll have to discuss it more. Okay, she cannot refuse. So this is in the best interest of child's health. So in the mechanism, as I told you, this is actually secretions related damage to the pancreas, thicky secretions. And very good, you ask me what is the problem, why I don't want to take the insulin. This is very good. Always teenagers, if they're refusing for something, explore the ideas why they don't want to do that. Okay, this, so you have explored my concern, that is good. I told you needle phobia. So for the alternative at this moment, because she is newly diagnosed with, so we cannot give any alternative. I don't know, you have given alternative for the tablets.
In the end, no, in
So
the end, like you were saying, like if you don't have any
yeah, so
alternatives, I can talk
I
to
don't
somebody
know.
else.
CFRD is completely insulin dependent, or
Yeah.
because I have
No,
studied some studies are saying that it's not completely insulin dependent.
yes, yes. In
Yeah,
adults, like if you're an adult now, like you can take this tablets
yeah.
as well.
This is only study I have studied before. This is only study, but I don't know what is in the guideline, because they have not written anything. They are saying in the study, one study I have studied
I'll just
before.
add on this. Okay, the American Diabetic Association says like cystic fibrosis related diabetics. There is no role of oral agents in the cystic fibrosis related diabetes.
Yeah, clearly
They
they are
recommend
saying
insulin.
Listen to me.
hypoglycemic
We
load.
will go only with the NICE and UK guidelines. We will not add
Yeah.
more American guidelines. So the best option will be, as she told in the last, she will arrange a meeting with the consultant, and also her parents can be present, and diabetic team will be there. Lastly, she has to tell her that refusing treatment is not allowed for her age. It will be done as a last resort. It will be done in her best interest, but before that, so many people will have a meeting with her and her parents, like that. What do you say, Dr. Rahman?
Actually, why, Dr. Noor, I'm saying that they particularly mentioned that this is 16 years old in the scenario. The first thing. Second, I don't know who has sent this message. He has written that she was refusing all the time. I will not take insulin. I will not take insulin. So here, I think this is my perception. They want us to know that this is she's not really competent to refuse the treatment at this age. That is in the best interest of her health. So I think so.
We have to tell
What
it
is,
in the last, not in the first.
yeah,
Like at the
in the
last
last.
resort, you can tell her when she's continuously.
Yeah, in the last, definitely you will have to involve the parents. You will have to involve your consultant and diabetic team, definitely.
Yeah.
And
One more thing. Yeah.
yeah.
Can I comment
Carry on.
something?
Yeah.
So what Dr. Royal is telling, right, that is very important, that they want. Other one is when any child is refusing, we have to ask them, do you know what will happen if you don't take insulin? And we have to tell them the consequences.
Yeah, consequences we
Okay.
should tell about that also.
Like
So
tell some examples, like she may go into
like
that.
what will happen immediate, we know, like
explain
DK.
DKA in layman's terms? How you will?
Don't use
No.
excuse me, don't use DKA, because CF related.
Yeah, obviously we will not tell DKA. We will tell about DKA in layman terms. Okay.
Yeah,
If you
are
are
very few patients of cystic fibrosis get DKA.
Yeah, DK they are not getting. They are not getting.
Hold on, guys, hold on. The only side effect related to not taking insulin and not controlling the diabetes is his cystic fibrosis will get further worsened. The secretions will get very sticky. She will have recurrent chest infections. She will get further admissions and repeated antibiotics. So we can manipulate her.
This is only. Always remember other. Dr. Faiza very nicely said. In CF related other like neuropathy or retinopathy, they are coming very late, and there is no decay. Very few patients experience decay. This is only the reason why he should start the insulin, because this will enhance her disease of cystic fibrosis. She will get more infections. She will have to admit, maybe get more admissions. This is they have written in the study. If you will see,
tram card I should have used because I
So-
totally forgot
Yeah,
about
So
it.
we need to convince her, I think. We need to
Yes.
convince her, like we said, diabetes, if not control, may affect her life and may affect her body image, like that, I think.
Like you can,
Rather than
a teenager
We'll
is a
close
very
all.
sticky
Wait,
subject.
Dr. Faiza, wait, mute all. One by one, open the mic. Okay, Dr. Rohel, first give your comment for this. Open the mic, please. Hello, I have muted all. Please, whoever is speaking, open the mic.
Okay. I'm speaking. You will have to tell that if you have already controlling your cystic fibrosis, you are regularly following your clinic. That's very nice. If you will not take this insulin, it will affect your cystic fibrosis. You will get more infections, chest infections, and for that you will have to take more antibug treatment. Maybe you will have to admit, you will have to get more admission in the hospital. So you will deteriorate your cystic fibrosis condition. So this is very much related to cystic fibrosis, because that's why they are saying cystic fibrosis related diabetes mellitus. This is our mutual. So you will have to tell like this.
Yes, yeah.
That's quite
Faiza,
right.
next you were telling something. Go ahead. You want to tell anything?
Yeah, the thing is that like teenagers is a very difficult subject. Okay, I mean, Dr. Rahel was a very innocent teenager. Like teenagers can literally make your life miserable. Okay, the thing is that you have to use their own sword against them. Like you can simply say, you can butter them up and say like you have been a role model and your cystic fibrosis is very nicely controlled, and like you are not having it, you are in a much better state. But unfortunately, if you will not take this insulin, all this effort you have put up till now to control the disease will go down the drain, and you will get repeated admissions and all these things. This is the way you can butter them up. But with teenagers, it's very difficult. Like he did not even a single second allow me to talk about anything. Absolutely, he didn't even let me to talk about insulin. He didn't let me to talk about pancreas. Like he was just saying, no, I know everything. So you have to take a way out of it.
Okay. Who else? Dr. Shri Devi, you are speaking anything? Shri Devi or Muzna, you have any comments? Yeah.
Only this one, like when they are refusing, we should tell like what is the consequences so that they may accept it. Still not accepting, then we'll also tell about the age.
Yeah, refusing is not
Yeah.
allowed. Well, how we will tell her? Refusing is not allowed in this age, or what?
Unfortunately, at your age, you cannot refuse. Okay, you can accept, but you cannot refuse. So we have to involve your parents. Okay, to take the consent about starting, or like to decide to take the decision about your treatment, like this.
You will, and also you'll tell you'll involve the consultant and diabetic team as well.
Yeah.
There is separate cystic fibrosis diabetics team, or what?
No, like it's like multidisciplinary team, and basically the endocrinologist looks into it, but basically it comes under the umbrella of cystic fibrosis.
Okay, cystic fibrosis and diabetic team both will take. Yeah, and yes, there were only jargon I thought is the pancreas. When you say pancreas, please explain it. Okay.
Yeah. I thought like the role player knew everything. Now, like he said, I know.
Even then, because this is not medical student, whatever it is, you just explain. And one more thing, you used malnutrition. I don't know, can be used maybe. I am not sure. I just wrote here, but I'm not sure. If, instead of malnutrition, anything we can say, or we can use malnutrition.
No, malnutrition would be a jargon. You are quite right.
You told malnutrition here.
Yeah, that was a jargon.
You told that you will even more lose by just controlling with diet. You will even more lose your weight, and you will have problems because cystic fibrosis will cause malnutrition. This is what where you use the word. So what better alternative we can give here?
Yeah, the thing is that since you have, cystic fibrosis already is causing a lot of burden on your weight, and you have to consume a lot of calories to maintain that weight. But unfortunately, if you have diabetes and you will not take insulin, all this, there won't be any benefit of all this diet because it won't get absorbed and you will lose weight and your cystic fibrosis will get worsened. Perfect. I
Yeah,
think
yeah.
this is the
Okay, something like this. Avoid jargons, because whenever you have doubt that some word is jargon, use an alternative for it. That is better. Okay, to be on safe side. That's all. Okay, I think.
Dr.
Okay.
Dr. Noor, just I have a comment.
Yeah.
This girl is 16-year-old. She can refuse. Why you said that she can't? She can refuse. Less than 16, those cannot refuse. Also, only can accept. But 16 or more can refuse this treatment. They are
16
considered
and more
competent.
can refuse, correct. More than 16.
16 and more than 16 can refuse.
Yeah.
Okay, then we cannot say
but I will have to open my book.
Yes, it is 16 the cutoff.
Okay, then don't say this. Just your final will be, you will arrange a meeting with the consult. You will arrange to her to have a meeting with consultant and diabetic team along with her parents is needed here because she can refuse the treatment.
Not sure.
The teenager was above 16, right?
16 years, exact. So what you will say?
That we will see the birthday
No, but
if she's below 16 or above, exactly.
I think even if they are above 16, they are not allowed to refuse essential treatment.
No, they can refuse. They have the right to refuse the treatment.
They have the right to refuse, but it is in their best interest. If we leave her, she will go into the problems. Still, we will allow her to refuse. We will not do it.
Yes,
refusal
cannot
and all
force her.
also has a clause. I don't think it is like you can refuse A to Z all treatment. It's not like that, I think.
I think this
You
is
have
like
to refuse this point, but they have it is divided from 12 years to 16 years. They have only the right to accept the treatment, but cannot refuse. From 16 and above, they have the right to refuse or accept.
Okay, I do agree with you, but at the same time, you have to tell her, as we discussed, the implications of refusing the treatment, like what it will cost to her health. Still, if she continuously refusing, you will arrange one more meeting with her, with the consultant and diabetic team. That's it. We will not tell more about refusing or accepting here because it's borderline. She's 16. Okay. That's better. And when we go, sometimes when you do ethics from Rebecca, we will get these points. We can search, no problem. Okay, if they refuse absolutely, what do they do? If it is harmful to their health, like in anorexia nervosa also, they may continuously refuse. A girl maybe 16 years, 17 years. So for their best interest, I think they will involve the parents or they will involve the social worker, and if nothing works, finally, if it is life-threatening, they can treat her, no problem. Like they can develop life-threatening arrhythmias or something, which they have to control, right? If it is life-threatening, under the court order or something, they can treat.
Hello, Dr. Noor, salam.
Yeah.
Yes, you are right in this situation because I am busy in work, but in this situation, especially, I hear one doctor in use the medication, but this is the best interest for them, for them to protect and to save their life. If we leave her to refuse, this may affect her life and put her in life-threatening condition. So we will not allow her to refuse. So we give her the information and we ask her why she refused or he refused that this insulin, to know what is the cost and if possible to treat it and treat. Then if it's still she refusing, then we should give her the warning sign. We make her to be afraid, a little bit afraid. This will affect her life, and you may lose your life at any time. It affects this and this and this in your body. And this, at the end, if she refuses still, then we arrange meeting with her parents and etc. But we will not leave her to refuse and go. That is it.
Dr. Noor, I think we should not, why to drag this this dilemma in the, we should not say, and if we involve just parents and just live with this, that would be much better, I think.
No, in this case, yeah, she is at present not in life-threatening situation at present. So we will not go for this further refusing. In this, the ending of the scenario, if is she continuously refusing, the ending will be, we will arrange a meeting with consultant and the diabetic
parents and the parents. I will also like
and
to
the
talk
parent, and also you can tell that you will involve her with the social groups related to diabetes also.
Yeah.
Okay, she will be already connected to cystic fibrosis diabetic team, but she will also see the children who have diabetes and who are taking insulin injections of her age. So we will involve her in the diabetic support groups also. We can tell her we will give you a link for the diabetic support groups where you can see and meet other children who have the same condition and who are taking injections, right?
Yeah.
All these solutions we can give her.
Can we better to move on other?
Okay, we'll go to the next. Our next is the Dr. Muzna, you're here?
Yeah. I'll send you the video just a moment.
Okay, just okay.